If you have numbness or tingling in your hands, then the 3 exercises in this video will help you out. As a physical therapist, I see a lot of different types of nerve problems, and the 3 exercises in this video are going to target the 3 major nerves that innervate your hands. Now, the first one is for your median nerve. That's the nerve that's involved in carpal tunnel syndrome. And it affects the first 3 fingers, your thumb, index, middle, and sometimes part of your ring finger. That's made up of the nerve roots in your neck from C5, C6, C7, C8, and part of T1. That nerve then runs down the front part of your arm, through your forearm, through the carpal tunnel, and into these 3 fingers and part of your ring finger. Now, the exercise for the median nerve is the median nerve glide. And we're going to put that nerve on tension by stretching it out and extending the wrist. That extends it over the shoulder, over the elbow, and over the wrist. Now you can put more tension on it by bending your neck away, which also tensions over the neck, or you can take tension off by bringing your head further over. That's going to affect the types of nerve glides called gliders and tensioners. Gliders or sliders put the nerve on tension in the arm and on slack in the neck. So it would look something like this. The nerve's on slack in the neck and on tension in the arm, and then on slack in the arm and tension in the neck. So you go back and forth like this. This moves the nerve back and forth through the tissues it runs through without stretching or lengthening the nerve. So these are seen as less aggressive versions of a nerve glide. So again, the slider or glider, you have slack at the neck, tension across the arm, and then you just move back and forth like this. Now, if you want to do a tensioner, where you actually apply a little bit of tension to the nerve, you just do the opposite. You put everything on tension at the same time, and then slack. Tension, slack. Tension, slack. As far as how many of these to do, you don't need to do that many. Probably 10 to 15, but doing them often throughout the day. The reason for that is nerves need 3 things to be healthy. They need space to move, they need movement, and they need blood flow. And when you do these nerve glides frequently throughout the day, you get movement and blood flow, which help the nerve. Now, if that part about tensioners and gliders got confusing for you, it gets confusing to me too. It's hard to remember all those steps. But again, you just need movement and blood flow. Those are going to be the primary things that help you out. So what's really important, just get the nerve to move. I often tell people, don't even worry about your neck movement. Just move your arm back and forth through this pattern as if you're touching your shoulder, stretching the arm out, touching your shoulder, stretching the arm out. And that's probably going to get you 90 to 95% of the effect as doing a full glider or tensioner without the headache and worry about if you're doing it right. So that's the median nerve glide for these 3 fingers. The next one is also going to be for these 3 fingers, but in the back of these 3 fingers. That's the radial nerve. The radial nerve also comes from C5, C6, C7, C8, and T1 in your neck, but it runs down the back of the arm, the back of the forearm, and into the back of these 3 fingers. Now, to do the radial nerve glide, you're just going to wrap that radial nerve around the arm and then flex the wrist to wrap it around the wrist. So this is the most tense position of it. And again, more tension would be moving your head away. Slightly less tension would be moving down like this. So to do the radial nerve glide, this will be the slack position of the arm, tension position of the neck, and then just move down to tension in the arm, slack on the neck. This is the glider, moving back and forth like that. If you want to do the tensioner, go into stretch on the neck, stretch on the arm, then slack on both. Tension, slack, tension, slack, tension, slack. And again, if you want to be pragmatic about it, not have to worry so much about moving your neck around, just go back and forth. Sometimes this is referred to as tip the waiter, as if you're passing a tip behind you like that. So that's the radial nerve glide. The third exercise affects the other two fingers, the ring finger and the little finger. The ulnar nerve innervates both the palmar side and the dorsal or back side of the ring finger and the little finger. That is lower down in the neck. It's primarily the C8 and T1 nerve roots in the neck, and to some extent C7. Now to do this, the tension position is going to be like you're carrying a tray like this. The ulnar nerve runs around the inside of the arm through the funny bone and then into the little two fingers. So to put it on tension, you're going to wrap it around the wrist, around the elbow at the funny bone or ulnar groove, and then through the chest here. More tension would be like this, less tension like that. So to do a glider, you're going to have slack on the neck, tension on the arm, and then tension on the neck, slack on the arm. And go back and forth like this. Now if you want to do the tensioner, go tension on the arm, tension on the neck, slack, tension, slack, tension, slack, tension, slack, tension. And again, the pragmatic version, just leave the neck alone. Carry a tray like that, go back and forth this way with your arm. And again, the reason these work is because your nerves need three things to be healthy. They need space, movement, and blood flow. With nerve glides, you get movement and blood flow, but you also need space. The nerves can't be pinched or compressed. And if they're compressed at your neck, in your thoracic outlet, around your shoulder, in the elbow, or in the wrist, that can put more pressure on the nerves, and it might even be painful doing the nerve glides. Now, to figure out where you have to take the tension off the nerve, you need to know where the nerve problem is coming from to begin with. And to learn more causes of numbness and tingling in the fingers and hands, you can check out this video over here. But before you go, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.